Erupted between the Department of Health in the Free State and the HIV/AIDS NGO Positive Action Campaign. Well, this follows a report from the University of Washington's Institute for Health Metrics Evaluation Research indicating that 21.3% of HIV-positive South Africans, that's almost a quarter, live in the Free State province. While the department says it's not perturbed by these stats because these numbers are people who previously did not know their status. It says it has done well to prevent HIV numbers from increasing. Positive Action says this shows the department simply does not care about communities. Let's take a look.
Following reports by the Democratic Alliance that the number of people infected with HIV here in the province of the Free State is increasing daily. We are standing in front of the Department of Health in the Free State. We have just spoken with the department to hear from them about these numbers. They are saying that people need not press panic buttons yet because they have campaigns to educate and also prevent the disease. But fortunately, I managed to get one of the activists who has been involved, especially with people, educating people here in the Free State regarding the disease, is Mr. Sello Mkalipi, who's going to tell us, as the organization, are they concerned or not about the disease. Democratic Alliance is saying that the number of people infected with the disease is growing here in the province. Are you concerned? Are you not concerned?
As Positive Action Campaign, I should say we are very concerned about the rising statistics that is happening in the province. It's not a surprise to us anyway, looking at the health system itself and how is the response by the department to these issues that affect not only people living with HIV. Here we're talking about lives of people who are not living with HIV as well. The question would be, who is at risk now? It's people who are actually negative, the ones that we would like to prevent from getting infected with the virus. But unfortunately, looking at the statistics now, the latest ones, looking at the prevalence that is rising in the Free State, it would say it confirms exactly what we've been saying. Remember, we've been marching during the course of this week to say we need services like the test kits that are not there in facilities. That is the first point. Medication that is not there. It could be part because you remember that when someone is taking medication and they adhere to their medication, their viral load is suppressed, so they are not infectious to other people as well. So they are not danger to other people. But now the danger part is we are sitting with a system whereby people go to test and they are returned. And once they are returned, it means they don't know their status. People will assume that they are negative. And once people assume that they are negative, then they become infectious. They'll engage in sexual intercourse, of course. And at some point, we can monitor whether that sexual intercourse is actually the protected sexual intercourse or not. So that is where it starts. Secondly, it's the availability of medication. If it's not there, people will then develop resistance. Once they develop resistance, of which is the case now, people have not been accessing treatment for 4 months. If people have not been accessing treatment for 4 months, it means those people who are not infectious, they are infectious. Now it talks to the statistics, it talks to the recent statistics to say the people who are not infectious, whom we manage to keep the spread of HIV with utilizing the available treatment. Now with the failures of the department, people are getting infected from the people who are not infectious. So that is the situation.
Talking about the department, they are saying that there's no need for people to panic because these are the people who did not know their status. As the organization, are you doing enough? Are you on those campaigns to educate communities as far as HIV and AIDS is concerned?
It would be a lame excuse to sit here and entertain issues that it's people who have not known their status. Once you go to test, you are a person who don't know your status. Whether you got infected yesterday, whether you got infected 30 days back, but the fact that you're going to test is because you want to know your status. And remember, most of the people who go to test are not the people who test by surprise. These are the people that continue to test after every 3 months or 6 months. So it means we are talking about people who are able to take initiative in terms of testing. And we are talking about lives of people here. it's not right that when such a big challenge, we are faced with such a big challenge, we come and make excuses as if we are not talking about lives of people. It's lives of people that we are talking about, lives that we need to protect. And we are doing enough ourselves as organizations, not funded by any government, not funded by any local funder. We are doing enough to reach out to the communities. But then reaching out to the communities, remember, we are not the extension arm of government. We don't provide essential services like providing treatment to people. We don't purchase condoms and give them to people. So that is the responsibility of the department. I mean, we're sitting in the Free State where at some point there's been shortage of condoms for more than a month. What has been happening there? It becomes difficult to expect people to abstain when people know exactly what comes with the pleasure of having sex. So those are the challenges that we faced with.
Where do these numbers, when you talk about these numbers, where do they come from? Last time when we checked, Thabo Mofusanyane was on top of our list as far as HIV is concerned. Where do these numbers come from?
I'm glad that people who compiled the statistics, they were compiling it based on the entire Africa, and they are the people who are funding South Africa, especially the Department of Health. They are funding Africans basically on programs of HIV and AIDS. So they get statistics from the same department that is questioning the same statistics, because they are funding the department. They come here, they ask for statistics, the department provide them with statistics. So if you provide people with statistics and you know where the challenges come from, there is no use for you to play political game when it comes to the people that are funding you, the very same people that you are providing statistics to. They now release the statistics after monitoring and evaluation of the program. Then you come and question the statistics that you provided to these people. Then it's a problem. It doesn't come anyway. It comes straight from the department. And this is a call for us to do more. It's a call for us to collaborate with our Department of Health. Of course, we can't work in silos, and it's about time. It's 2019, we can't work in silos anymore. We need to collaborate efforts. We need to make sure that we come on the table, we come to the drawing board, we put our stake on the table, the department puts its stake on the table, other partners from outside put their stake on the table, and we see how best we cap this, all of us.
Selom Kalipi, one of the activists of HIV and AIDS here in the province, saying that we need to do more, work together with the government to prevent the prevalence of HIV and AIDS. It's back to the studio.
Well, last week